Today we'll look at the subject of arthritis and joint replacement with a focus on hips and knees. Heekin Orthopedic Specialists is renowned for its leadership, excellence in joint replacements. Led by Drs. David Heekin and Gavin Duffy, also performed by Dr. Deshmukh. Dr. Duffy, formerly the Fellowship Director of Joint Replacement at Mayo Clinic in Jacksonville, a hip and knee specialist. He is nationally recognized as an expert in advanced implant technology. Dr. Deshmukh, a Jacksonville native, specializes in joint replacements of hips, knees, and shoulders. Dr. Heekin, founder of the practice, pioneered minimally invasive hip and knee replacement surgery in the Southeast and is the medical director for the Orthopedic Center of Excellence at the St. Vincent's Medical Center, Riverside. Last year, Dr. Heekin performed more hip and knee replacements than any other surgeon in Florida. What are joints, and what can cause us to have problems with these? Simply put, it's where two bones meet and connect to tissues like ligaments, muscles, tendons, and cartilage. Our joints provide our bodies with the mechanical support that allow us to move. Trauma from sports or other activities, along with degenerations associated with conditions such as arthritis, account for the greatest number of joint issues.
Well, arthritis is very, very common. It causes a huge amount of disability, pain, and discomfort in our population. And unfortunately, as our population ages and with the higher activities our older patients do, and the fact that more of our children have played sports growing up, there is more and more arthritis in the country than there was 20 years ago.
Shoulder arthritis, like any arthritis, can be a traumatic event. You fall, something breaks, something gets damaged, cartilage breaks off, or over time, with repetitive wear and tear, arthritis can build. So if someone is a carpenter or laborer or even a really avid weightlifter, those are some of the patients that I see that have really severe arthritic changes in their shoulders. And that wear and tear process between the ball and the socket joint can become quite significant. This is a picture of a socket in the shoulder, and the ball is what rotates on that. And those two cartilage surfaces then start to wear, the gliding mechanism breaks down, and then it's more of a catching, ratcheting feeling and pain with every motion. So it can be very, very crippling, very painful for patients.
Do playing sports predispose us to arthritis? Dr. Duffy believes that it really depends upon what type of sports we're participating in.
Sports can predispose you to arthritis if they are high impact or contact sports where you actually injure your joints. Sports by themselves, running, swimming, many different sports are obviously very healthy and good for you, and your joints are designed to do that. Contact sports where a 300-pound guy runs into your knee is not designed to that, and you tear a lot of ligaments and cartilage, you will end up damaging your knee long term. So repetitive, heavy contact sports, yes, those joints probably won't last as long as they could have if they hadn't participated in those sports. But most people do those sports in their teenage and 20 years when you think you're invincible, and arthritis is not even a concept that you're considering. So it's a reality that some of those sports do end up wearing out your joints earlier, yes.
Osteoarthritis is the most common joint disorder, and while sports injuries can lead to this condition, Dr. Duffy knows that it's more often simply a matter of aging and wear and tear on the joint.
Osteoarthritis, or more commonly called wear and tear arthritis, is where the cartilage at the ends of your bones wears down. There's lots of different reasons it can happen. The most common is just life and use. It can be due to injuries, trauma. Some people don't have very strong cartilage and it can run in their families. Either way, the cartilage wears down to the point where it starts to get pitted and worn down. That's when your joints start to creak and ache, and then eventually, unfortunately, start to hurt. And when it gets very bad, we call it bone on bone, because there's no cartilage at the ends of the bones. There's actually bone grinding against bone, and that's what arthritis ends up being. Very painful as you try to walk and move your joints. It hurts because there's no cartilage left.
Osteoarthritis of the hip is one of Dr. Duffy's focus areas. He notes that symptoms can be often frustrating and misunderstood, but shares some signs that hips may be wearing out.
The hip is a ball and socket joint there's a socket and a bowl, and there should be a space between it where the cartilage is. And as time goes by, that wears down till you get too close to being bone on bone. People don't know this, but hip pain is typically deep in the groin. A lot of people come in and say it's in their buttock. That can be hip pain, but a lot of that could be referred pain from your lower back. But groin pain, thigh pain, that typically is a symptom of a hip that's in trouble. At the end stage of a very bad hip, it really, really affects your life. People will be using a cane. Their families will notice that they're limping a lot. They tend to get kind of miserable and grumpy because they're in pain all the time, and they may not even realize this as it comes on. And at the later stage, it will wake you up in bed and you're not even comfortable sitting down. So when it's bad, it can get very, very bad, and that's when people really come in just looking for help and even consider surgery, which will fix the problem.
Despite how hip replacement sounds intimidating, it's actually the most successful orthopedic procedures around. The relatively quick surgical procedure allows patients to regain much of their active lifestyle that they're accustomed to prior to surgery.
I love doing it because it's so successful and the patients have such a great result. You take somebody who has difficulty walking, has had to stop all their sporting activities, can't even go to church on Sundays, and get them back to church, get them back to their sports, and take the pain out of their hips. I enjoy it because the patients like me to help them with their pain. It's very, very successful. The surgery takes less than an hour. We basically open up your hip, and the worn out cartilage we remove, and we place a metal socket with a plastic liner and a little spike that goes down your leg with a femoral, with a ball on top of that to replace the ball and cartilage, the ball and socket cartilage that's been worn down with metal and plastic. People are typically in the hospital 2 or 3 days after that. A lot of people go home. Some people do need to go into a rehab facility, but the majority go home and do their therapy at home. And by 6 weeks, I tell people they're 70% better, really back to a lot of activities, depending on where they started from. And by 2 months, you're completely healed up and just doing wonderful.
Being able to walk and enjoying an active lifestyle is very important in fighting against obesity and other health conditions. Americans continue to fight the battle of the bulge, and healthy joints like hips and knees are critical for this. Obesity can further aggravate our joints, which raises the question, is obesity on the rise because more people are suffering from arthritis, or is arthritis arising from obesity? Dr. David Heekin elaborates.
The relationship of obesity with arthritis is difficult to say. We certainly know that, for instance, in the hip joint, when your leg is on the ground, 2.5 times your body weight goes through the hip joint. That's a large amount of force. So if you weigh 100 pounds, that's 250 pounds through your hip joint. If you weigh 350 pounds, you do the math, it's close to 1,000 pounds through that hip joint. Well, our articular cartilage, the cartilage which lines into the ball in the hip joint, was never meant to support that kind of force. And so if we artificially make it resist greater forces than it was designed for, than it can withstand biologically, then it fails. It's just that simple.
If arthritis causes your hip pain, you may also develop arthritis in your knees, since arthritis most commonly occurs in these two joints. In fact, Dr. Heekin notes that our knees are often subject to even greater force than our hips.
The knee joint is even worse. In the patellofemoral joint, in the kneecap part of the joint, your kneecap is attached to your quadriceps, so that when your quadriceps fire, it gets you up out of a chair, helps you go downstairs without falling on your face, and that part of the joint is particularly poorly designed. The bottom line is, 4 to 6 times your body weight goes through your kneecap when you get up from a chair, go downstairs. Now 4 to 6 times, that's a huge multiplier. And so if you're obese, then you're putting more force on the cartilage than it can withstand, and it wears out. It's just that simple.
Obesity isn't always linked to arthritis. In cases where it is, joint replacement can help restore a patient to a healthy and active lifestyle.
Numerous patients that have joint replacements who come back and they are so proud of themselves. They say at the 6-month visit, they say, I've lost 40 pounds. You go, whoa. And that's huge. And I had a gal who lost in the first year 90 pounds. just by getting out and increasing your activity level, walking with your family after dinner. And I don't expect people who are obese to get in spandex and go to the gym. I mean, I wouldn't do that. But I think that it's very comfortable to get out and walk with your family and spend time with them after dinner. And that walking, if you can get up to 1, 2, 3 miles, you can really burn a lot of calories and restore your health.
Joint replacement is not only one of the most cost-effective medical treatments, it's also one of the most successful orthopedic procedures due to the improved technologies and techniques. Dr. Heekin explains it's not the same procedure some of us saw our grandparents go through.
Well, joint replacements, have come a long way, just like anything that, automobiles, TV sets, computers. It's a combination of things. It's better biomaterials that I mentioned. It's surgical technique. We know how to put these things in through small incisions. It's less trauma to the soft tissues. We're not leaving people laid up writhing in pain for weeks on end. Now they get up and walk an hour after their surgery. That's huge. So we get rid of all the complications that can happen, or reduce them. That's probably fair. Blood clots, which we used to see a fair amount of, we hardly ever see blood clots. People are walking. All of us are walking today. That's why we're not going to get blood clots. And the same thing happens with patients. So when they get back to their room, they're up walking right away with the physical therapist. That's huge. Then they sit up in a recliner. That opens up your lungs, keeps you from getting pneumonia. People used to lay flat in bed for 2 weeks. When I started doing this 22 years ago, we used to keep people in bed for a week. And then they all got blood clots and pneumonia. We wondered why. Hello. And so now we get them up walking right away. We don't see that anymore. So it's a combination of good biomaterials, improvements, surgical technique, rehabilitation. All those things have come to pass so that we now understand the science of this, and we can get people up walking quickly. It's less time out of their life recovering from this, and it lasts a lot longer. We can expect, rather than 10 years, we can expect these things that hip replacement to last 40 years, or the knee replacement 20 to 30, depending on activity level of the patient. Does it work? Medicare studies things that they pay for. Every year, Centers for Medicare and Medicaid Services, CMS, it's a federal agency, looks at the procedures that Medicare pays for. They want to know, do they work? Is it cost effective? Should we keep paying for it? And so of all the things that Medicare pays for, they looked at all the procedures. Last year in August in the New England Journal of Medicine, it was reported also on the Wall Street Journal, total knee replacement was the most cost-effective procedure that Medicare paid for. More cost-effective than cataract surgery, open heart surgery, gallbladders, colon cancer, anything. Total knee replacement was more cost-effective.
Dr. Heekin knows that your health is important. He takes personal pride in knowing that he's helping you along the way.
My goal and my philosophy in private practice was similar to what I had held in the Army, and it's that each person, your health is one of the most important things to you. Next to spirituality and right there with your family is your personal health. And so if you entrust your health to somebody as a healer, as a provider, that's a huge leap of faith, and that's a huge amount of trust. And you should never betray that trust. You need to go out of your way to let them know that you do care for them, and to take that extra step if they seem worried about something, and who wouldn't be worried about having surgery? That's a normal emotion. They should be worried. And I walk up to patients in the holding area before we do surgery, and I say, "How are you doing?" They say, "I'm scared." I say, "Well, if you weren't scared, you'd be crazy. I mean, I've had surgery. I was scared to death, right?" And so, but just to talk to them and say, it's going to be okay. And I've done this a lot, and not only myself, but every member of that team that works with me is very skilled in what they do. So you're in the hands of people who care a lot about you, who know what they're doing, and they're gonna make sure that you have a good result, and that you come through this thing, and that you're back doing the things you wanted to do. And that sort of confidence, and that sort of, and it's not just blowing hot air. That's the proof's in the pudding. And if at the end of the day, when your surgical procedure is done, you've just started in their care, because their post-operative care, pain management, make sure that they're comfortable, make sure they're meeting their physical therapy goals, make sure that where they are in the process is where they want to be, that you've met their expectations, and if you didn't, examine why. Say, well, maybe you were unrealistic. I had a guy that I did a knee replacement on, and he thinks he's going to be back at work, and he's in a very strenuous job in 1 week. Well, you can't do that, and I told him that, and he says, well, yes, I will. But and it's going back through that and trying to help him develop realistic expectations, but also helping patients meet their expectations, because most of them, if you coach them a little bit, they'll work as hard as they can to get through this and to get back to where they wanted to be. And it's just a matter of coaching them and letting them know that you'll be right there with them. You're a partner in this, and you'll help them achieve their goal.